Hey, Dr. Cohen at Backbone here. We're going to talk about some of our corrective phase exercises that we do for people. And these are some of the targeted spinal rehab that's done in it's very specific, it's very targeted, and it's really designed around improving flexibility and strength and range of motion of the entire spine, not just one area as we move through these exercises. There are 3 sets, so we have beginners, intermediates, and advanced. I'll always instruct a person when it's time to move from one set to the next, simply because I'm looking for certain signs on the patient and certain tolerances to make sure that it's actually safe and that you're ready to move forward. So Heather here is going to be doing the beginning set for us first, and I'm going to talk her through it just like I would talk you through it if you were standing here in front of me wanting to learn how to do these. She's already laying down here on position on the lumbodorsal fulcrum, right? The big bubba that I talked about in the spinal molding video. I'm going to emphasize you have to be on this big one in order for these exercises to work right. So if you've been hit and miss on spinal molding and you've been on the small one and you say, well, I can't quite do the big one for 20 minutes, you're not ready for these exercises yet. Get back on your spinal molding, work through those consistently, and you'll be ready for this in no time. So the beginning exercises, and this is the other part of them. So Heather, I'm going to show you how to do these, and I'm going to kind of walk you through each of them. You're going to notice that they're really pretty simple exercises in the beginning. The beginning ones especially, they're not that difficult. They're not hard to perform physically, but what they're about isn't simply the strength, but it's about creating a pattern between the brain and the control over the musculature of the spine. So it's what we call neural engramming. It's creating that pattern and that pathway so that the brain has the more you use it, the better it gets, kind of a thing. The more times you walk through the forest on the same path, the better the pathway gets kind of worn through for you. And that's really what we want to do with this, is about teaching the body and the musculature how to move, how to stay stretched, how to do its thing correctly. So the first couple exercises are really pretty simple. And I want you to bring this knee all the way up to your chest, pull as hard as you can, but without the hands. And that's what everybody does. That's why I didn't stop her. I'm like, let her do it, and then we'll see it, right? So she's pulling up here nice and hard. She doesn't have to really push with this leg, but her pelvis is rocked up and off of the fulcrum. She's going to hold for a count of 5, and then you're going to switch legs. So it's just right there, a nice easy 1, 2, 3, 4, 5. And then she would switch back and forth doing 5 count, right? Slow, easy count of 5. We're going to start with 5 repetitions. You do it 5 times, and then usually in about 3 days, people are able to work up to 10 times. And that's pretty much it for the first one. Right? That's the what we call LD number 1, lumbodorsal exercise number 1. Exercise number 2, and this one is going to be I want to make sure you can see this. So it's going to be kind of creating this figure 4 pattern here with the leg. And so as we drop out, the important part here is she creates the cross part of the 4. The ankle needs to be not on the bench or on the floor as you'd be doing these at home, and it needs to be the heel next to the opposite ankle, but not touching it. So we're not resting on the ankle here, and we're not resting on the floor here. It's just right in that position, and we let the knee drop out, so we're actually working on stabilizers for our hip, cross stabilizers for the lower back. And it's the same thing here. We're going to count 1, 2, 3, 4, 5, and then make the switch to the other side. 1, 2, 3, 4, 5. And then again, switch back and forth 5 times. Start with 5 repetitions, work up to 10, usually in about 3 days, no problem. The third one, and this is the final exercise in the beginner fulcrum set. So Heather, cross your arms like so for me, and she's going to do kind of a half crunch. And I say a half because I don't want you coming way up high. You're going to just clear your body off of the bench, or in your case, you'd be doing it off of the floor. So go ahead and lift up just straight up here just a little, and that's a little too high even. I want her just a touch right there. 1, 2, 3, 4, 5, and relax down. The trick to this one is to use your eyes. You kind of pick one spot on the ceiling, and you choose whatever it is, I don't care. But you pick one spot on the ceiling and you keep your eyes on it the whole time, so that as you come up, it's head and neck stay in a neutral position, not curling in here. Okay? So pick a spot, come up, hold there, boom, plenty. 1, 2, 3, 4, 5, and relax down. This is the one that's probably going to challenge you the most, especially if you haven't done a whole lot of sit-ups or if you're not doing planks or core exercises. You'll feel this one a little bit. Not unusual, people to come up and then they kind of start to shake just a little bit. Very, very common. You get used to it pretty quickly. Again, we're going to start with 5 times, count to 5 times. Within about 3 days, you should be up to 10. Those are the lumbodorsal exercises. Now we're going to add the cervical dorsal, which is cervical dorsal is the neck area here. And when we talked about spinal molding, we said, you're going to use this notched cutout to be able to do these exercises, right? When you're doing for the spinal molding, excuse me, when you're doing the actual exercises, we're not going to use the notched cutout. We want to train that angle of the neck a little bit more sharply. So what we do is we simply take the fulcrum and we flip it around. So now we're using this flat edge. It creates a bigger lift, and it's going to give us a more focused exercise. It goes underneath the neck the same way as it did when you were molding. It certainly feels different though, doesn't it? It's like, oh, I feel the difference there. Okay, what we're doing is we're creating a leverage point, a fulcrum point, hence them called fulcrums, for the musculature to fold over and then work in that position. And this is important because we're really changing patterns. We're not just strengthening muscle in whatever position they're in. We want them in their optimum position and then work on strengthening them. Otherwise, we're going to strengthen somebody in the wrong position, and that's important. So for this one, Heather, you're going to put your hands up on your legs here, and all she's going to do is push down and back with her head and pushing with the arms at the same time. So the arms are driving the shoulders kind of down and back. She's pushing, you can't really see her muscles activating, but she's pushing down here pretty hard. And then it's going to be that hold, 1, 2, 3, 4, 5, and then relax. And you could probably guess 5 repetitions, work up to 10 within 3 days. The next 2 exercises, when a person is on here, when you're just looking at them, it's kind of hard to tell what they're doing. There's 2 exercises, the 3, but so the first one was the pushing straight back. Numbers 2 and 3, we're going to go from that push back extended position, we're going to add side bending, we call lateral flexion, and we're going to add a rotation. And that's the difference between the 2 exercises. So one of them is pushing back and kind of bringing the ear to the shoulder. The other one is pushing back and trying to bring the nose to the floor. Okay, so Heather, push back for me, and then let's go to the left. So tilt that ear to shoulder as hard as you can. So she's activating all these muscles along the side of her neck as well as the back. And she's going to hold for 5, and then relax. And then she's going to push back and do the same thing to the opposite side, ear to shoulder. And it's hard to tell when you're on here, but you can feel the muscles along the side doing the work. And then relax. And it's going to be the same 5 count, 5 repetitions, build to 10 within a 3-day time frame. And then the last one here is going to be pushing back, and instead of tilting, we're going to turn. So it's going to be back and turn as much as you can. And the difference when you're doing this one, again, I can feel it because I can feel the musculature as we're going. If you're watching the video, you're going to, I can't see much of a difference, and it's hard to just physically see it, but when you're turning the head, you can feel, we talked earlier about this big SCM in my PTLMS video. We talked about this big muscle here that shows up when you turn your head. So when I push back and then I turn, we're going to get more activation here than when we push back and tilt. Tilting doesn't activate this muscle, turning does. And if I'm turning to the left, I'm activating the muscle on the right. So Heather's going to push back and she's going to turn her nose down, and I can see the muscle right here already activating and sticking up like it should be because it's been turned on there. And she's going to hold for that count of 5 and then relax and then turn the other side, still pushing back first, and this one you can see that muscle just beautifully right there. And it's going to be that same 5 count, 5 repetitions, build to 10 within 3 days. That's going to be consistent throughout the program. Of course, we can always modify that as a person needs, but remember these especially are not hard exercises. This is not so much about building muscle strength as much as it is building correct neurological pathways to those muscles. Thanks.